Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in Pharmacy Medicine. In today's video, we'll continue with delirium poisons. In that, we'll discuss mainly about poisoning from cannabis plant. Cannabis plant, it has two species, Cannabis sativa and Cannabis indica. It is also known as Indian hemp or dope grass. It grows all over India, but its cultivation is restricted by law. It has different names all over India. Some name as pod grass, dope weed, hush, marijuana, hashish or bhang. This is the image of cannabis plant and it is the image of flowers of cannabis. The female plant of cannabis is taller, about 4 to 6 meters, and has more darker luxuriant foliage than the compared to the male plants. The active principles are contained in its resins of the plant. Coming to active principle of cannabis, the principal constituent of a resin of cannabis plant is cannabinol, which has no action as such, but when cannabinol is exposed to heat, it is partially converted to very active isomeric tetrahydrocannabinols, which are poisonous. So, tetrahydrocannabinol act as widely distributed specific receptor regions of the brain. All parts of the plant, male or female, contains the active material except root and seeds. All parts consist of cannabinols. By action, it is a CNS stimulant. It also has a psychoactive drug. Coming to absorption metabolism, THC is metabolized in the liver. It is a lipid soluble and rapidly absorbed after inhalation. 1% penetrates blood-brain barrier. About 2/3 of the drug is excreted in feces and 1/3 is in urine. On oral ingestion, 3 to 6% of tetrahydrocannabinol is absorbed. It is mostly widely used as illicit drug in the world. Coming to commonly preparations of cannabis, there are different forms of prepared from different parts of the plant. First is the bhang, which is commonest. It is also known as siddhya or sabzi. It is prepared from dried leaves and fruit shoots. It is used as a tea to prepare a decoction and drink as drunk. It is mildest and contains only 15% of active principle. Fresh bhang is highly intoxicating and narcotic if stored longer. It is mildly stimulating and pleasure giving. So if it is stored, it is mildly stimulating and pleasure giving if it is stored. Fresh bhang is intoxicating. Next is majon. It is a sweet prepared with bhang. So bhang mixed with sweet is called as majon. It increases appetite as well as sexual desire. Third preparation is the ganja. It is prepared from flower tops of the female plant. It is mixed and smoked with tobacco in pipes or hookah. It contains about 15 to 25% of active principle. Pot grass, weed, marijuana, which is also known as marijuana, are the different names given to ganja. It is used for smoking in cigarettes, which contains about 0.3 to 0.6 gram of cannabis and are known as reefers or joint. Next preparation is charas or hashish. It is a resin or a dope or a shit excluding from the leaves and stems of the plant. So the plants are, whenever they are scorched, there are resin which exudates. The charas is prepared from that, and it consists of about 25% to 40% of the active principle, that is THC. It is mixed and smoked with tobacco in a pipe or hookah. Hashish oil, it is a concentrate form of the charas. It is a concentrate of cannabis and is produced by repeated extraction to yield a dark viscous liquid called hashish oil. 1 to 2 drops of oil is added to tobacco of cigarette and smoked usually. Coming to signs and symptoms of cannabis, they appear soon after a person who smokes and last for 1 to 2 hours and within half hour after swallowing and last 2 to 3 hours. So it can be smoked or swallowed. If it is smoked, it lasts for 1 to 2 hours. The symptoms starts to appear 1 to 2 hours, and if swallowed or 2 to 3 hours, the symptoms starts to appear. Taken in small doses, the effects are very slight, which usually includes euphoria, passivity, heightening of subjective experiences, and disorientation. With moderate dosage, these effects are intensified by impaired immediate memory functions, disturbed thought patterns, lapses of attention, subjective feeling of unfamiliarity. High doses produces changes in the body image, depersonalization, and marked sensitivity distortion. The intoxications last can be divided into psychiatric symptoms as well as physical symptoms. So psychiatric symptoms are more common in cannabis than physical symptoms. First is the feeling of detachment from reality. There is clarity, there is cleverness, is lost, dissimulation, depersonalization, euphoria, elation, relaxation, well-being, then dreaminess, sleepiness, self-confidence, jocularity, laughing, silliness, rapidly changing emotions are seen. Then thought process is lost, in that there is irrelevant thoughts. Person has altered reality, decreased concentration, attention span is decreased, altered sense of identity, disorientation is seen. Then sensory novelty and increased awareness of stimuli, in that there is a vivid images, illusions and hallucinations are seen. Then feeling of precordial distress and tightness in chest leading to fear of dying. Altered concepts of time and space occurs. There is a change in the body image, depersonalization, self-confidence, altered sexual feelings are present. Then there is maladaptive behavior effects like impaired judgment, failure to meet responsibility, speech changes, in that there is a rapid speech, impaired speech, person will be talkative, filthy or poorer, loss of immediate memory. Then during so-called trip, due to distortion of perception, the person usually feel they could fly from high windows or stop passing buses with their bare hands, which may lead to accidental deaths. Coming to physical symptoms, here the person has increased appetite and thirst, slight nausea, heaviness, pressure in the head, dizziness, dysesthesia, somnolence, paresthesias, restlessness, ataxia, tremors, dry mouth, tachycardia, urinary increase in urine frequency, and congestive conjunctiva. The characteristic odor of cannabis is present if the person has smoked the cannabis, but it is not present if he has ingested. Some sensitive individuals, particularly persons recovering from mental illness, may develop paranoia after relative low doses. Paranoia is nothing but the person feels that someone is trying to kill him. That is one of delusion it is present. The victim becomes drowsy and passes into deep sleep and wakes with exhaustion, impaired mental function, and recovery occurs in about 6 hours. So as dose increases, death occurs with extreme rarity due to mainly because of respiratory failure. So as dose increases, the symptoms changes. Coming to fetal dose, charas it is 2 grams, ganja it is 8 grams, bhang which is the least potent form, it is about 10 grams per kilo body weight is fatal. If only active principle is considered, 30 mg per kg weight is fatal. Fatal period it takes for several days, hence the person death by cannabis per se is very low. Treatment: stomach wash or emesis or active charcoal and kinetic, mainly to remove any person if the person has consumed the poison, it is useful. It is also useful because cannabis re-enters the bloodstream and it can be present in stomach. So stomach wash is helpful. So it from the blood, if the person even inhaled, it can enter the stomach. 100 ml of 50% glucose, 2 mg of naloxone, 100 mg of thiamine is given as precautionary for any other symptoms. 5 to 10 mg diazepam if the patient is violent or aggressive. Anti-anxiety drugs and if necessary antipsychotic drugs such as haloperidol is also prescribed. Then psychotherapy is given. Most of these are only symptomatic. There is no specific antidote present for cannabis. Post-mortem appearance, again they are not characteristic but are those of asphyxial signs will present like cyanosis, congestion of organs, then particular hemorrhages will be seen. Those are 3 signs of asphyxia will be present. Coming to chronic poisoning, since it is commonly abused form of drug in all over India, chronic poisoning is commonly seen. The use of drug is small quantities even for long period is not harmful. Tolerance and psychological dependence develops. Used in excess, it causes degeneration of central nervous system and insanity. Chronic use reduces serum testosterone, sperm count, and associated with gynecomastia. There is loss of appetite, weakness, wasting, tremors, sleepy facial expressions, vacant look, red eyes, impotency, and moral and mental deterioration is seen. Rarely they become insane, that is also known as hashish psychosis, condition where the person develops form of psychiatric illness and may suffer from auditory visual hallucinations. In a way, auditory visual hallucinations, even though there are no stimuli, like there is no sounds, even then the person hears something that is auditory. In visual hallucination, there is no one present or no object is present, but the person perceives that there is some object or some person standing in front of. There is also delusion of persecution, that is person feels that someone is trying to kill him. That is one form of delusion is present. Then heavy marijuana users may develop maniac and paranoid psychosis where the person will be hyperactive. One form of chronic poisoning leads to run amok condition. It is a psychic disturbance marked by a period of depression followed by violent attempts to kill people, that is impulse to murder. So here the person first goes in period of depression followed by person has impulse form of psychiatric impulse to kill a person. He first kills a person against whom he may have a real or imagined enmity and then kills anyone that comes in the way until the homicide tendency lasts. Then he may commit suicide or sometimes surrender himself. Chronic use may also lead to motivational syndrome with loss of age appropriate behavior like lethargy, lack of interest in day to day activities at home and school. If the abuse is continued for a considerable time, it may lead to behavioral problems, crime, and even mental derangement. It does not cause physiological dependence or addiction. So, cannabis it is not a dependency present, but the person just wants to consume, even though there is no dependency, there is no withdrawal symptoms occurs. So, there is no withdrawal is present in the cannabis. There is no dependency is present, even then person may consume. Cannabis compounds LSD can be detected in biological specimens by radioimmunoassay procedures. Marijuana is a potential carcinogen and may lead to cancer. Coming to circumstance of cannabis, most of the cases of poisoning are due to overindulgence, but there may be accidental ingestion or inhalation. Marijuana and charas are sometimes used by road prisoners to stupefy a person to facilitate robbery. So this is also road prisoners they use where they give large doses of marijuana by smoke. They put the leaves in the decoction or fire in some smoke and lead to stupefy the person for robbery. It is sometimes taken by criminals before committing a crime to strengthen their nerves. It is also used as aphrodisiac and supposed to increase duration of coitus also. Some in religious aesthetics and religious mendicants often take cannabis to overcome hunger and thirst and believe that it helps in their concentration of mind towards medications. Fakirs often believe that bhang frees them from worldly attachments and brings about participation with divine spirit. So this is mainly used from some religious group of people. They use cannabis as a form of reaching the God, though it may lead to accidental overdosage also. These are my references. Thank you.